We're at the New Hampshire State House where we have Representative Valerie Fraser to talk about two bills before which committee?
Health and Human Services, 361, which is in regards to opening up the HHS divisions that decide which vaccinations are going to be given to the commissioner to approve, is to try and get that from a fairly closed system to an open system where we can have public input and use the legislature, which is our duty to represent our constituents, to decide which vaccines will be mandated for school children. House Bill 362 is specifically to prohibit one vaccine, which is hepatitis B, from the requirement for schools. Now, it's still available. It's on the CDC schedule. New Hampshire has all of the vaccines if you wish to vaccinate your child, but we want to remove it from the school setting because it is not communicable in the way that we think of when we think of an IV drug abuser or a sexually promiscuous person who as an adult, could contract hepatitis B from their lifestyle. But in a school setting, that probably shouldn't be happening. We shouldn't be having any of those issues in a school setting, therefore not requiring the hepatitis B vaccine. There's no testing for employment required for hepatitis B in New Hampshire, and children who have active hepatitis are allowed in school, so children who are not vaccinated should be allowed in school. And that's the crux of it.
So the hepatitis B vaccine has been mandated for quite a few years. What has brought this issue up now in 2017?
I think with the fact that CDC is preparing more and more vaccines, and we've had, since 1980, we've had such an increase in vaccination that children are required to have, that we're seeing skyrocketing incidences of autism. In 1980, it was 1 in 10,000. Now it's 1 in 26. And the only thing that's changed in every state in the union has been the vaccination schedule. Nothing else has changed. They're still drinking the same water. They're still eating, basically the same foods. There are more toxins in the environment, but we can't. It's different in every state as far as what they eat and what they drink. But the vaccines are the same across the board.
President Trump has recently been in discussions with Robert F. Kennedy Jr. about having a vaccine commission that would look into vaccine safety and scientific integrity. This issue has been discussed at the national level. At the local level, what do you see as the prospects for bringing forward bills such as this right now?
I don't know that we'll be able to bring much more in until and I applaud President Trump for doing that, and with Robert Kennedy Jr. for opening up this conversation and trying to look into some of the accusations of fraud and for money, kind of for profit over the safety of our children. And so looking into that, we're hoping that they'll either form a commission or a Capitol Hill hearing or something that can bring this to light to the public, because these are questions that need to be asked. Are vaccines safe and effective? The industry will tell you, yes, absolutely they are. Well, the parents of, unfortunately, vaccine-damaged children or dead children will argue differently. And mothers, as a mother, we have that instinct. When the baby is absolutely fine, gets a shot, and 4 hours later is having seizures or high fever or screaming or banging, whatever, and then the doctor says, oh, it's coincidence, that's really hard to believe. That seizure was just going to happen anyway. It just happened to happen after the vaccine was given. That's what we hear a lot. That's hard to believe. So this is all an attempt to make some sense of all of this, to protect our children. If vaccines can be proven to work and they're 100% safe and effective, they'll tell you they're not 100% now, and we know that. Maybe they'll be good, but for right now, there's a lot of pushback to the extraordinary number of vaccines that are given to children.
Very good.
Yeah.
Thank
Good.
you.
Thank you.